Hey, so now we're going to talk about peptic ulcer disease. This is probably my favorite part of the GI system. I don't know if you saw my other video on the upper GI bleed, but I've revealed that in that video. So we're just going to basically talk what is it. So it's an erosion of the GI mucosa from the digestive action of hydrochloric acid and pepsin. So as we know, hydrochloric acid and pepsin have an extraordinarily low pH. So they're very, very acidic. And that can eat away almost anything, including your own stomach or small intestine. So, yeah. There are acute, chronic, and duodenal ulcers. It can be caused by H. pylori, which is a kind of bacteria, nicotine, which is found in cigarettes, stress, drugs, so like aspirin, NSAIDs, stuff like that, because of the NSAIDs is because of the decrease of prostaglandins protecting it. So usually take NSAIDs for your pain, but a lot of times what happens is your prostaglandins work for other things than just your pain. So basically what's going to happen is I don't know if you've seen my farm videos. I might have explained some of this in them. But basically what's going to happen is that your prostaglandin levels are going to drop, and so that you won't have that protective laying on the layer of the stomach anymore, as well as some other things that we can talk about later. Okay, so let's just talk about the symptoms. So the symptoms of a gastric ulcer is really terrible pain about like 1 to 2 hours after meals. And it's burning and it's like a lot of gas, So if it had eroded from through the mucosa, food would aggravate it. So yeah. And then the duodenal ulcer is when gastric acid comes in contact with the duodenum. So this happens 2 to 5 hours after a meal, and it's burning and crampy, and you feel kind of nauseated. And we can try to treat this with antacids, an H2 blocker, which is a histamine blocker. We talked about this for nausea and vomiting. It can help with these too. And food, you give them food and it provides relief immediately. Because what's happening is your gastric acid there's no food in there, so your gastric acid's fighting with itself, and it's eroding your contents of your duodenum. So food can be really helpful. So complications, I bet you can guess one. Hemorrhage is definitely a complication. You're right. Perforation, and sometimes there can be a gastric outlet obstruction. So we need to decompress the stomach, and decompress the stomach. So the treatment is like adequate rest, right? Dietary modifications to decrease gastric acidity. So like don't eat like very acidic foods, very spicy foods, what have you. And then drug therapy is also a good treatment, another important part. And then elimination of smoking. Please, please, please try to stop smoking. Ask your provider if you need help. They will be happy to help you. Because this is really important that you need to stop smoking, because smoking decreases, alcohol also decreases the pH of HCl and makes it more come out. And then also we just need to use the long-term follow-up. So we need to check in with our patients, make sure they're doing okay. So these all like enhance the mucosal defense systems. So it's kind of like your mucosal defense systems are kind of like your bodyguards. So they're like, hey, like we don't like this, but sometimes they don't work. And in these situations, in peptic ulcer disease, they still erode the mucosa. But it really tries for you to do what it can to kind of fight off any kind of ulcer or infection you might have in your stomach. That's like the old saying that you can eat a nail and still be okay. Um, so yeah. So some drugs that we can use are proton pump inhibitors, which decrease hydrochloric acid. These are especially good for duodenal ulcers. As I said before, we can use H2 receptors. And then we can also use antibiotics to murder H. pylori. Um, but we have to make sure we know it's H. pylori because we know that we don't want to give antibiotics if it's not an infection, especially if it has to do with the stomach, because it can really mess up the stomach, the gut bacteria. So there are surgical procedures. We can do a partial gastrectomy, which is taking part of the stomach out. There's a vagotomy, which is like they cut. So your vagus nerve kind of like runs down, down here, right? So basically, it's a sympathetic and parasympathetic nerve. So like if you're having a panic attack and you go down into turtle, right? The turtle position, you're compressing your vagus nerve, which is lowering your blood pressure and your heart rate. And so sometimes, basically, more importantly, that is what releases the gastric acid. So sometimes what they'll have to do is they'll cut it so that it doesn't release as much gastric acid. And then there's also a pyloroplasty. And complications of the surgery are dumping syndrome, which is there's too much chyme in the small intestine. So it's like all of this hypertonic fluid is like raging right in to the small intestine, and it's kind of not ready for it. So that's dumping syndrome. And postprandial hypoglycemia is like this similar idea that you're kind of when you're eating, your food comes out too quickly, so that you're not you're like not getting the nutrients that you need to get. And then also the bile reflux, gastritis. So goals are obviously compliance with the therapy. It's hard for some patients to comply, and we need to reduce the comfort, and we need to heal. That's a part of our job as nurses, is to heal. So that was about it for peptic ulcer disease. I hope you enjoyed it. Yeah, have a good day.